Hello and welcome to this Q&A session. Parenting is a joyful experience and there's nothing more exciting than bringing up your little bundle of joy. But newbie parents are sometimes beset with worries about their child's health and well-being and do not know who to ask these questions from. This is where we come in to help you. We try to answer all your questions by bringing in the experts. So, for today's session, I would like to welcome Dr. Rajiv Chhabra, who is the head of the pediatric department at Artemis Hospital. He will be answering all your questions related to baby care and addressing some of the common issues that keep on coming up time and again. Welcome to the show, Dr. Chhabra.
Thank
Now,
you.
Dr. Chhabra has over 20 years of experience and believes in caring for babies and families and not just treating them. He uses a 360-degree approach that extends beyond medical treatment, aiming to improve diet and nutrition. We are privileged to have him on board. In this session, we have taken up the questions which have been sent to us by you, and he will be happy to answer all your questions. So, Dr. Chhabra, let's get started with the queries right away.
Yeah.
Nana has sent us this question saying, what is hand, foot, and mouth disease and what causes it? Can it be cured?
Nana, this is a very good question and very common problem as well. Hand, foot, and mouth disease is caused by a virus which spreads through contaminated surfaces. Let's say if a child gets this disease and those kids tends to drool a lot or put their hands inside mouth and uses table or uses pencils or any other thing or spoons, they tend to spread from one person to other. So it's quite a contagious disease. I call it as nuisance more than anything else, mainly because the lesions which are there inside mouth, they causes loss of appetite. Child cannot eat anything. They tend to drool a lot, having mild grade fever. So the less intake of fluids may result into dehydration, resulting into admission into the hospital. Otherwise, for lesions on hand and legs, we don't need to do anything because they generally don't bother.
Okay.
It does not cause any itch, it does not cause any pain. So, in a nutshell, you don't have to worry. It's just that you need to keep the child indoors so that they don't go outside. Unfortunately, the child is contagious 48 hours prior to the onset of illness. So, we don't know a child is already spreading the illness to their friends when
Okay.
inside incubation period.
Right. But you said it's a viral disease.
Yeah.
Are there any medicines to treat the symptoms or reduce the duration of the episode?
Unfortunately, for all the viral illnesses, we don't have any medication. As we do have antibiotics to kill bacteria, we don't have medications for viruses. So it's all a symptomatic relief, which means we can ask them to apply some pain relief gels inside mouth. We can give multivitamins to help them healing the wounds, ulcers inside mouth. And that's it really. For pain or for fever, we can give paracetamol or mefenamic acid if need be. So we cannot curtail the duration of illness. That's what
What
I
is
call
the
it
average
as
duration of this illness?
somewhere around 5 to 6 days are generally lost from school absenteeism because of
Okay.
this illness.
Okay, so there is no medicine that can be given. It lasts about 5 to 6 days. The only thing you can do is to perhaps isolate your child from public areas so that the disease doesn't spread further. Now we have a question from Rakhi. She says, "My son is just over a month old and gets gas. How can I prevent this?" I'm guessing that she is still breastfeeding her child.
Yeah.
Is it normal for breastfed children to have gas? What can be done?
There are many myths, Rakhi, surrounding this gas inside the tummy of an infant. What we hear generally is if mothers are eating something, that can result into increased gas inside the tummy of the infant, which is not right, actually speaking. Mother's feed, according to me, has no correlation to gas formation. The exact reason why a gas is formed inside an infant is not known. The theory behind it is when 9 months inside the womb, child gets all their nutrition through umbilicus. And all the excreta also comes out through the same thing. When the child comes out of womb, the child is getting nutrition through mouth. The intestines are moving. When the intestines are moving, it causes pain. That's what is the cause of gas. This is what we believe. So as I mentioned, Rakhi, it's a quite common scenario seen in 85% of my practice. You can give relieving measures like putting hot warm bottle over child's tummy, or you can use some medications on the prescription of a doctor. Otherwise, it's a common scenario and you don't need to worry about it at all.
Which
It
is
will
saying,
get
how
better
can I
with time.
prevent it? Any prevention step, like you said that a change in diet does not necessarily mean that there will be lesser gas, but
Yeah.
anything else that a mother can do to relieve the child of this gas problem?
See, kangaroo mother care, which means laying the child over father's or mom's tummy, may help, but otherwise there is no way to prevent it, unfortunately.
All right. So holding your child close to you for the longest time perhaps is the best way to comfort your child, but there is no other way that you can prevent the gas pain that your child is feeling. Pallavi is asking, what is colic pain and what are some remedies for the same? Now, my subsequent question is that a lot of people say colic is normal and routine in children, and all through the day the children are fine. It starts in the middle of the evening and it lasts till the middle of the night. The child keeps crying. Is stomach pain. Is this true?
You are so right. It happens in the evening, and we don't know why it happens only during evening hours. It worsens. Colic is a medical terminology, and gas is a layman language.
It's the same thing.
It's the same thing. It's the same thing. So, again, you can use some local home remedies like putting hing ka pani over child's tummy. I don't know how much it helps, but definitely it does not have any side effect. You can put hot water bottle over child's tummy. It should not be extremely hot. Should be wrapped in cloth or a towel.
Okay.
And there are certain medications available which also can be given by your pediatrician.
Okay.
They are absolutely safe, known to us for last 70, 80, 100 years now. So they can be
And
utilized to
can be
relieve the
safely
pain.
administered to babies of what age?
So whenever the colic happens during infancy only, and it stays up till the age of 4 months.
Okay.
So all these medications are
Safe to
actually
give.
safe. Yeah.
Are these available OTC, or they have to be taken by
No,
prescription?
they are available OTCs as well, and nowadays studies are going on role of probiotics in colic. So there are a couple of probiotics available in the market, which also have been proven to be of immense benefit when given to kids with colic.
Okay. Would you be able to name some of these OTT medicines that can be taken safely?
So something like Colicate drops, Colimax drops. In Ayurveda there is Bonison drops,
Okay.
which is known to each and every family.
Right. The next question is coming from Pooja. She says, my 2-year-old frequently gets worms. What can I do about it? Now, I don't know how she's deduced that the 2-year-old has worms, but she's got it tested and she says that it happens often. What can she do?
So again, it's a slightly bizarre question to answer because how often the child gets worms and how do they come to know, it's a difficult answer for me. But if a child is proven to have worms by getting a stool examination done, then a deworming schedule can be done, which is at an interval of albendazole given within a span of 2 weeks. So if, let's say, one dose is given today, the second dose will be given after 2 weeks. Most people tend to forget the second dose, and which is equally important. The reason being, first dose kill the worms, but not the eggs. So the eggs stay inside the body, which hatch, and then they become worms in 2 weeks' time.
Okay.
So unless a proper deworming is done, which is like 2 weeks span, the child will be in vicious cycle of worms.
Oh.
And the other thing which I want her to remember is it has to be done every 6 monthly.
Has to be done
Every 6 months. It's always better to do that.
Okay, so do get deworming done every 6 months, and make sure you take both the doses if they are recommended, so that the entire cycle is completed and there are no eggs that get left behind, and then recurrent episodes of worms keep happening. Geeta has asked us a question. My son is 10 months old and has started standing with support. What can I do to make him stronger and better prepared for walking?
So at 10 months is again, I would say, a right age to walk. There isn't much you can do to increase the strengthening of the bones besides giving adequate diet which is rich in calcium. People tend to ask doctors for shortcut leading to medications. I generally favor diet more than medications. So adequate sunlight, By adequate sunlight, I means 40 minutes a day, 5 days a week, at least for Indian skin. Along with that, adequate intake of milk and dairy products, and massage of legs and other parts of the body will help in strengthening and building of bones.
Right. The 40-minute per day of sunlight, is there a specific time during the day that a child should go? Because, it gets very hot in India usually, most parts of India. So we generally avoid going out when it's too warm. Any particular time of the day, and how can you do 40 minutes in the sun with a child? Is it playtime? Is it massaging in the sunlight? What would you recommend?
It's a very intelligent question. So the ultraviolet light is strongest between 10 a.m. to 4 p.m.
Mm-hmm.
So those are the time periods when one should avoid going out.
Okay.
But besides 10 to 4, any time which can include playtime or massage time, but the layering of clothes should be minimal.
Okay.
So
exposure to arms and legs should be there to the sunlight to absorb the.
Yes, as well as thin layer of clothes on other body parts.
Okay. So there is only as much you can do with massage, some time in the sun, and a good diet for having a baby strong and healthy. What about things like walkers and all those aids? Some doctors tend to feel that they should be discouraged. It should be a natural approach. Some people say that walkers only hasten the process of walking quicker for toddlers and infants. What would you say?
No, there are no two school of thoughts about this thing. Walker definitely delays walking.
It delays the walking.
Yes, the walker where the child sits inside,
Mhm.
that definitely delays walking. So I generally don't recommend more than 5, 10, 15 minutes when a mom wants to do something home chores.
Mhm.
At that time, they can definitely put the child over there, but nothing more than that. In good old days, there used to be a stroller where a child used to
Just push.
Yes, so those are encouraged
Okay.
for walking. So those are good things to have.
All right. The next question is from Karishma. She says, my toddler chews anything that is within her reach. How do I avoid this? I think this is a story in every household. I mean, is it avoidable? Because we tend to worry that they may put hazardous things in their mouth or dirty things in their mouth that leads to, diseases or choking hazards.
I agree. See, they tend to take all sort of nonsense things which you don't want them to, they will put inside their mouth.
Mm-hmm.
What I generally tell them is you can get nibblers from the market,
Mhm.
or you have muslin cloth at home. So you can put either a cucumber or apple slice or a carrot taken out of refrigerator,
Mhm.
cleaned and washed, put them into nibblers or muslin cloth, and then give them to the toddler. So they will chew on it, they will bite on it, they will reduce the irritation, will get the juice out of it and won't choke.
Okay.
But other than that, I still can assure you the child will swallow and tend to take all sort of dirty things inside mouth. They tend to fancy all those things which you hate.
Mhm. So there's little you can do other than give them a healthy alternative,
Yes.
which will be also safe. The next question coming in is from Juhi. She says, how to treat loose motions in babies? First of all, Dr. Chapa, can you define what is loose motions for babies? Because, some parents are very anxious and, just after a couple of loose stools, they tend to worry. What is
I
loose
totally agree with you.
motions?
We tend to receive phone calls with every loose motion you can imagine.
Mhm.
I must tell our parent viewers is that in a newborn age group, up till the age of 6 months at least, 10, 12, 15 times of loose motions is absolutely normal.
Mhm.
Nothing to panic. At times they may pass once in 7 days also, which is also normal.
Mhm.
So as far as her answer goes, if there are loose motions, you need to provide adequate hydration to the child
Mhm.
in form of various liquid stuff like coconut water, soups, apple juice, buttermilk, yogurt, banana, anything which has ORS, which is flavored ones, can be
Mhm.
given to kids. And keep giving breastfeed if the age is suitable, or normal homemade diet can be offered. In terms of medications, ORS and zinc plays a mainstay role.
Okay.
So ORS has to be given as frequently as the child wants. Zinc is given once a day for 10 to 14 days. Besides that, if a child has got bacterial infection which will be diagnosed by a pediatrician, then they may choose to start an antibiotic.
Mhm.
But otherwise, as a parent, I would give more of fluids
Mhm.
and zinc.
So what if the child is not on any solids, is not taking any external, feed like coconut water, bananas,
Yeah.
dahi, or any of these which
Yeah.
are recommended at the time of loose motions? What if the child is very small? Because there is a fear of dehydration
Indeed.
when loose motions happen. What can parents of very small babies do?
So increase the amount of breastfeeding. If we
Okay.
were feeding every 3 hourly, I would suggest them to feed every 2 hourly or as and when demand.
Okay.
So the first sign of dehydration is the child will be slightly more irritable, slightly more hungry and thirsty. So as and when the child is crying, you need to offer breastfeed.
Okay. Any medicines that can be given if the situation is, I mean, if the child has passed many stools and you're breastfeeding often also, it doesn't seem to stem. Any medicines that are given?
So ORS and zinc, as I have mentioned earlier, there aren't any medications to stop motions in kids. The reason being, if we stop motion in kids as we do in adults, chances of septicemia, which means the bacteria can stay inside body and spread into the bloodstream,
Okay.
resulting into septicemia, which is much more of a disastrous consequence
Then
than
loose motions.
gastroenteritis. Yeah.
Okay. So do not give any medicines to your children without your pediatric mentioning them, which could include ORS and zinc. But do not give any medicines to your child. Just give more breastfeed if the baby is very small. The next question is from Amrita. She says, how long after birth does the umbilical cord fall off? What is the best way to take care of it?
Amrita, the cord generally falls off between day 7 and day 14. But before that also you will see a bit of ooze, pus or watery discharge coming out of umbilicus, but nothing to panic. You just have to clean it with cotton and water and then wipe it with dry cotton. The standard recommendation is to apply any of the chlorhexidine ointment over it, but in practice where all hygiene practices are being followed, you don't have to do anything except keep it clean and dry. So I generally recommend all my parents to just keep it clean with a moist cotton and then wipe it with dry cotton, and that's it.
Okay.
Nothing to panic even if there is bloody discharge coming, because it is going to stop in next few days. You just
Okay.
need to keep it pressed.
Right. Kirti asks, my daughter is 14 months old. Is it too early to start potty training her?
Our book says, Kirti, that we need to start potty training somewhere around 2.5 years of age. But in practice, what I have seen and encourage parents is, if a child is not repulsive to the idea of potty training, you can try even at 14 months of age.
Okay.
So just encourage them to go to washroom at frequent intervals, or start water as well, because the noise of water somehow, I don't know why and how, but it tends to help them in potty training.
Okay.
So if
So
the
you
child
mean
is not
flush,
crying,
using the flush?
yes.
Okay.
If the child is not crying excessively when the
Mm-hmm.
child is being taken to washroom, I would say that is the right age.
Okay.
But if the child is crying, then you need to stay calm for next 2 months and then again give a try.
Okay. So you have to watch your child and see how your child responds to the entire potty training exercise for you to be able to perhaps judge whether the time is right or not. The next question comes in from Ria. She says, why do some babies suck on their thumb and how to stop it? Now this, there are two views about sucking of thumbs.
Yeah.
Some mothers say it's a bad habit, stop it, because if it becomes a habit, your child's teeth will not grow properly, the formation of the jaw may be impacted. Some others say this is the baby's mechanism to self-soothe himself. He learns how to cope with different environments if somebody's not heeding to his cries immediately. So this is the emotional development of the child. Don't stop. What would you say?
Whatever you have said is absolutely right. What you have said is allow them to take the thumb inside mouth is right at the age of 4 to 6 months.
Okay.
Because at that age, thumb sucking is considered, or hand to mouth is considered, a normal milestone.
Okay.
But if this phenomena persists, let's say more than 12 months, 15 months or 18 months, then whatever you said the other way around was also right, that it is going to spoil the teeth formation.
Okay.
So for thumb sucking at the age of 4 to 6 months, don't discourage. For thumb sucking between 12, 15 or 18 months, you need to discourage. So either you can put bandage or things like bitter things like neem or whatever you want to do. There
To
are certain
discourage them.
yes there are certain bitter medications also available, or you can put mittens as well. So whatever. I hope I am able to clear this query
Okay.
for you.
So thumb sucking is good only till a particular age, but the main problem is that to stop your child once the habit forms,
Yes.
it gets tough.
Yes.
So then should you just not let your child take the thumb, and even at a smaller age?
Yes.
Okay. Let's move on to the next question is from Deep Mala. She says, my baby is 7 months old and I recently started solids. Is there any indication that she is getting adequate nutrition? Now, during the first year of a child's life,
Yeah.
Solid food I think is never really source of nutrition. It is just variety. The real source of nutrition is actually milk and mother's milk mainly, right?
No, I won't agree to that, unfortunately. So, yeah, milk is sufficient up till the age of 6 months.
Okay.
After that, solids have to be taken over.
But for the calories they provide,
For
the
everything.
micronutrients.
For everything for that matter.
Okay.
So that's why what we call it as, in good old days we used to call it as weaning. Weaning means we are reducing milk. But nowadays the terminology has changed to supplementing. So what we call as complement or supplement now, the milk. So the quantum and the frequency of milk intake should go down, and the intake of solids should start growing up after 6 months of age. So that the ultimate goal is the child should be sharing everything from our plate at the age of 1 year. So between the age of 6 months to 1 year, the meal texture also should become coarse to the extent that child can eat whatever we are having at the age of 1 year.
I think why the question is coming about adequate nutrition is because most of the breastfeeding mothers I know will exclusively breastfeed their child till up to 6 months and introduce solids at 6 months. Now, in the first 6 months, that whenever your child cries, you offer milk, he has milk, he's happy, you feel satisfied. Now, after that, when you're introducing solids, it's a very small amount. It starts with only a couple of tablespoons. You feel we eat a whole plate full, our child is eating just 2 tablespoons. Is this enough?
I agree.
So that is where, how do you know that the child is getting enough nutrition?
So a general mistake which is done by mothers is, if they have tried one thing and the child has not eaten that thing, they should not be fulfilling the child's need by milk. Milk cannot supplement after 6 months of age. So you need to wait for child to again be hungry and then again try something else after 2.5 hours. Otherwise the child won't develop the taste for solids for sure.
I know some mothers who give the 2 tablespoons and then said, if he's hungry, let me give some milk. He'll have milk.
No. That's I don't agree to that, because milk intake should go down and the solids, and that's how they will develop taste for it. If you keep replacing, child will be in comfort zone that if I don't eat this, my mom is going to provide me milk. So why do unnecessarily bother our palate?
Okay.
So you need to be firm and stern and don't get dictated by a 6-month child.
So you're saying offer food. If the food is not taken well, wait
Try
till the child
else.
is
Yes, 2.5 hours.
again.
Yes, 2.5 hours. Wait for something else to be offered.
Okay. So your child will get the nutrition from solids, and make sure that the amount of solids goes up post 6 months, because by 1 year, Dr. Chhabra says the child should be ready to eat out of your plate. Even the coarse food that you're eating, he should be ready to have different textures.
So at 9 months the child should be introduced to finger foods.
Okay.
And as far as her query goes, we can follow it up by the growth of the child, which include weight. If the child is gaining weight, the length is increasing, head circumference is going at a normal pace, I think one should be satisfied with that.
Okay, and those checks happen regularly, so you will know how your child is performing on solids. Now, the next question is coming from Nidhi. Is there anything particular that I should start with when I start solids for my baby? In India, there is an entire ceremony of starting solids. It's an important milestone. What is the first thing to introduce to your child?
So it has to be a composite mixture of fruit and a veggie and a cereal. So I offer them few choices among fruits, like steamed apple or steamed pear or chiku and banana. I give them fair bit of choices among vegetables, which include things like potato, sweet potato, carrot, uh, and later on they can start giving green veggies, things like loki,
Dal.
and among cereals I would offer them dal, then khichdi, upma, halwa, all those sort of things can be started from 6 months of age.
Okay.
One thing I must tell at this stage is one of the bad practices in India is to give dal water.
Mm-hmm.
We strongly discourage that thing. Dal water does not contain adequate amount of calories.
Okay.
As a consequence, the weight of the child goes down.
Okay.
So that's why government has to take a stern action that till 6 months exclusive breastfeeding, followed by you can give dal like moong dal or masoor dal, which
But
does
not
not have,
water.
but not dal water.
Okay.
And the dal has to be without chilke wala.
Okay. Not the sabut one, the dhuli dal. The next question which is coming in is from Nandini. She says, my baby is 3 months old and I breastfeed him. Is it true that he doesn't need any water if I'm breastfeeding him?
Exactly. So breast milk contains 97% water.
Mm-hmm.
So you don't need to supplement that by giving extra amount of water at all.
Right. Madhu asks, what is the ideal age for toddlers to join play school?
Our books mention 2.5 years for mother and toddler group.
Mm-hmm.
Before that, we believe that the child is not socially and emotionally adaptable to circumstances at mother and toddler group.
Okay.
So 2.5 years is the
2.5 years is an ideal age for a toddler to join a play school. The next question is from Harsha. She says, how much water should my 2-year-old have on a daily basis?
Harsha, this is a very interesting question, but very difficult to answer. My suggestion would be to offer water after every feed. So let's say you have given breakfast, you can offer the milk water to the child,
Mm-hmm.
and quantity is always determined by the child. So whatever amount child wants is okay. If the child is thirsty, will ask for more.
Mm-hmm. Kusum asks, my baby is 1.5 years old and he frequently catches a cold. How do I avoid it? I think frequent colds is like every day for small children. Is there anything you can do?
So I generally tend to advise all my mother parents is to give honey 1 teaspoon daily.
Mm-hmm.
Honey has to be proven to be of immense benefit in Western literature these days.
Mm-hmm.
Along with that, I strongly recommend giving vitamin C in natural form, which means things like oranges, amla, nimbu pani.
Mm-hmm.
And vitamin C again has to be proven to be of immense benefit in
Honey,
prevention of
after a
respiratory
particular age, because
after 1 year.
After
Yeah,
1
you
year.
are so right. Yeah.
Because there are some cases of botulism, right?
Yes. Yes.
So honey should be avoided in the
till
first
till
1 year.
first birthday.
Right. The next question is coming from Apurva. I have noticed my nephew eating chalk a couple of times. Is this something to be worried about? You know, when we were much younger, we used to have walls which are whitewashed and we used to lick the walls. Is this normal?
So, eating chalk could be a sign of calcium deficiency at times, or at times iron deficiency. So, you need to get the child examined by a pediatrician.
Mm-hmm.
If they are deficient in iron or calcium, then the doctor will start adequate medication for that.
Mm-hmm.
In terms of diet, I would suggest iron-rich diet, which include green veggies, apple, papaya. Dates and gur are supposed to be very rich sources of iron.
Mm-hmm. So you should give a nutritious diet to your child. Richa is asking, is the toddler's first aid any different from adults? What happens when they get cuts and burns?
It's nearly the same. You need to follow the basics, which is if there is any bleeding or any wound or any trauma anywhere, you need to apply a lot of ice or cold water.
Mm-hmm.
So at that time, to reduce the swelling, to reduce the pain, ice will help.
Mm-hmm.
And afterward, if the wound is deep, you need to take to nearby emergency.
Okay. Jyoti is asking, how do we find out allergies in children?
The simplest answer is there aren't any reliable tests to diagnose allergies in kids. So the only thing what we can do is go back to history.
Mm-hmm.
If a mother is saying that my child had eaten this, following which developed all these lesions or whatever, then we tend to rely more on history rather than any blood test.
Okay.
Some doctors do those tests, but I generally don't recommend them because those tests are not 100% reliable.
Okay. Prerna has sent us this question, how to give steam to babies for relief during cold and cough?
So steam it should not be given in a normal fashion as we tend to give in adults, like covering the face on those sort of things. It should be kept at a distance because accident prevention is the key rather than having benefit of the steam. So you can keep it on one side of the room, or you can keep it below, and you can keep the child on your lap. Those are the ways of giving a right way to the child.
Okay. Next question has come in from Naresh. Naresh says, our baby is 2 years old and has been having incidents of nose bleeding every 2-3 months. What is this normal? Is this routine? What should the parent do?
Nosebleed is quite common in kids, especially up till the age of 5 years, and more so in hot weather. The first aid which I generally recommend to all parents is to pinch the nostrils for 5 minutes, make the child sit upright. What we tend to do is lay the child on the bed, which is not right, because in that way the blood which has been lost through nostrils has a tendency to go into windpipe and the child may choke. So we should discourage that thing. The child should be sitting upright, pinch the nostrils for 5 minutes, ask the child not to blow hard through nostrils for next 4 hours, and they should do the trick. If a child is having frequent nosebleeds, it's always better to get the child examined by either a pediatrician or an ENT specialist.
Okay. The next question has come in from Shraddha. She says, my baby's nose seems to be, blocked when he's sleeping because the inhaling and exhaling is very loud. What could be the reason here, and what can Shraddha do?
The child may be suffering from what we call as enlarged adenoids. Adenoids are organs same as tonsils, but which we cannot see with our naked eye. It's inside the nasopharynx area, this area, which can be confirmed by getting an X-ray done. Once adenoids are confirmed, you can use some nasal spray, which is recommended by a pediatrician, some anti-allergic medications for prevention of allergies, because these are the two most common reasons for adenoidal enlargement.
So, if your adenoids are enlarged, your nose will be blocked.
The child will snore at night time because overall the windpipe gets narrowed drastically. So, using these mechanisms can help, but if a child is still snoring loudly at night time, or the child is failing to grow because of lack of oxygen supply to various body parts, then it's always better to get them removed surgically.
The adenoids.
The adenoids, yes.
Okay. The next question coming in is from Gaurav. He says, my baby boy is 2 years old. His skin is reddish and he has itching in 4 places of the body, that is behind both his knees and behind the elbow. Please suggest what can be done.
What he is describing are the classical places of what we call as atopic dermatitis, which is nothing but allergic dermatitis, which means child has a tendency of allergies. So it's again, I call it as nuisance illness, mainly because you need to keep applying moisturizers frequently. So there are certain hypoallergenic moisturizers available in the market, which will be prescribed by a pediatrician, and those have to be applied frequently. Maybe 2 hourly, 3 hourly, or every hour if need be. And if it still worsens, then a small dose of steroid to be applied topically, again on the prescription of a pediatrician, and that should help. Wearing cotton clothes will be of immense help, and the child should not be sweaty.
Okay. So with that, we've come to the end of this session. We hope you've enjoyed it and have taken away many important information nuggets. And from here on, we will hope to keep answering all your questions. We would like to thank Dr. Chhabra for taking the time out and coming here to answer all your questions. Stay tuned and keep visiting our page frequently. If you have questions, send them in. We will use them during this Q&A, the subsequent Q&A sessions, and try to answer all your questions. Till we come back with another Q&A session, we'll see you again.
Thank you.